when a patient has a stroke.
Time lost is brain lost.
We are here for them 24/7.
Immediate state-of-the-art treatment.
In our hospital.
Supported by a superb team.
We are stronger because of the network.
Jefferson Neuroscience Network, it's all about patient care. The Jefferson Neuroscience Network really started as a mission-based initiative to partner with hospitals in the region to be able to deliver acute stroke care at institutions that didn't have the bandwidth, the neurologic bandwidth, to deal with those types of patients.
The network is really a collaborative initiative between Jefferson and hospitals in the community, regional medical centers, medical professionals, working together to enhance neurological care for patients. The focus of our network has really been stroke care, acute stroke, because stroke is a very time-sensitive disease and requires quick interventions in order to maximum outcomes for patients.
When a stroke occurs at a community hospital, we are then alerted by a telephone call telling us that a patient needs immediate evaluation to rule out the diagnosis of a stroke. We then immediately beam in using our telemedicine or a robot, and then we then discuss the case with an emergency room physician to see what is actually going on with the patient. We then have the capability to actually speak to the patient, see what symptoms have been presented, and what the next step would be.
The use of IV-TPA has significantly increased in the care of our patients in our emergency department. Prior to the stroke program and working collaboratively with JNN, we did not administer IV-TPA to our stroke patients. We have seen symptoms resolve and those patients be discharged back to their normal active life.
Our teams assembled pretty quickly. We knew that we needed help in the ER. We knew we needed physicians not only in the ER but on the floor, and that everyone in the hospital needed to understand what a stroke looked like. So early detection of a stroke could be the most important thing you do, because then it gives you the time to be able to develop your care plan. After having spent time with the network in our meetings and asking all of the questions that I'm sure every other hospital asked as they pursued their stroke certification, we began to realize that this was something that we could master. We had so many people in support of it, and knowing that at the end of it all we would be able to serve our community in another dimension that we had not until then been able to do was very inspiring for everyone.
Since the implementation of our stroke program at Chestnut Hill Hospital and our partnership with JNN, we've been able to greatly improve the outcomes of the patients that we see in Chestnut Hill Hospital. About 1/3 of our patients today are transferred down to Jefferson for intervention or follow-up care, but we are now able to keep about 2/3 of those patients in our community close to their families.
From the hospital perspective, the relationship has greatly increased our ability to treat patients with stroke or stroke-like symptoms.
The decision to give TPA is a complicated one at times. By having the input of the neuroscience physicians at Jefferson, we are able to give TPA in a timely fashion to more of our patients. As a consequence, we give TPA at 4 times the national average. That is why we have better health and better stroke care in our community.
I think one of the major advantages of the network has been that 80% of the patients who are treated for stroke care stay in their community. They do not need to be transferred. So we are treating strokes at the partner hospitals. They are staying at the partner hospitals. It's good for the patient, it's good for the family, it's good for the institution. There's not a quid pro quo that if transfers are required, that they have to come to Jefferson. That's certainly the decision of the patient, the referring doctor, and the family.
I do remember an instance where I was driving home one day. I got a call that there was a stroke patient at the local emergency room, and beam in to the patient at the emergency room, get the story, evaluate the patient, and the patient was indeed a candidate for acute intervention with thrombolysis. The recommendation was then to proceed with a treatment, and he got it and was later transferred to a comprehensive stroke center.
We had a young patient, relatively young, in his 40s, who had a massive stroke, and we were able to transport him down to Jefferson, where he had a retrieval of a clot and almost full recovery and he was discharged from the hospital back to the community, where that never would have occurred without our association with JNN.
I have spoke to a few of the patients to find out initially to see how did they feel talking to a robot, and actually they said after a while they didn't even realize that the person was not in the room with them, that it was very well accepted with them as well.
Being a member of the Jefferson Neuroscience Network is not just about the robot and remote presence. It involves education of nursing, it involves education of physicians, it involves public education and education to their community, not only in stroke care but in all areas of neuroscience, and that's very important. Education is really a key component of the network. I think the most important thing about the network is what the network has given back. It's all about elevating the level of patient care in the community, and it has done that in spades. And I think if you would talk with our partner hospitals, I think they would verify that.